Cancer is a disease of the cells, and the whole body is made up of cells. The cancers are named according to which part of the body it affects. That brings the different types of cancer. For instance, we have cancer of the cervix, where the cells of the cervix are affected. We have cancer of the prostate. We have cancer of the breast. We have cancer of the lung, and any other cell that is affected in a particular organ of the body. The cancer is named according to that. At the Regional Cancer Center, we particularly do screening for 3 cancers. One is the cancer of the prostate, cancer of the cervix, and then cancer of the breast. Why do we do screening for these 3 cancers? Because statistics show that they are the most common cancers, particularly the cancer of the cervix, cancer of the breast, and cancer of the prostate, in that order. These are the top 3 leading cancers that we see in this hospital. And these cancers can be screened. But what do we mean by screening? When we talk about screening, we are looking at procedures or tests done in a healthy person to identify any suspicions for cancer. The bottom line here is we are saying screening is done in a healthy person. So you don't need to have chest pain, you don't need to have abdominal pain to come for screening. Any person who is healthy needs to be screened. Cancer of the prostate, we do start from 40 years because we realize cancer of the prostate normally is common in the senior citizens. By senior citizen, we mean men who are at least 70, 80, and 90. But then we also have some few men in 60 and 50s who are diagnosed with cancer of the prostate. And why do we really start at 40? Because we realize cancer is a unique disease in that it progresses slowly. Actual cancer is a slow progressing disease because your cells can start changing today, but it will actually develop into cancer in 10, 15, or even 20 years. So it is a slow progressing disease. A clear example is the cancer of the cervix, where you can start to be affected maybe 10 years ago, but the cancer comes in later. So that duration the cancer takes to develop into a disease called cancer is what triggered the screening, because at screening, we're able to identify any abnormality or any changes in your cells where we suspect this cancer to be, and appropriate steps can be taken to curb down the progression of this into a cancer. That's why we have the screening, which is very important. But also, cancer is a disease that can move to other parts of the body. You may have the cancer of the prostate, but in the near future, you find it has come to your liver or it has come to your lungs. That is what we call metastasis in science, but that is how the cancer moves. And that is when cancer becomes difficult also to manage, especially when it has started to move to other parts of the body. That's why when we do screening, we identify any abnormalities, we are able to act fast, and we prevent any further spread of this cancer. I would like to encourage all men, especially those who are eligible, I mean those who are 40 years and above, to really come and uptake this prostate cancer screening exercise, because the fact that you have the prostate, which has cells, you are a candidate to this cancer of the prostate, because it affects everyone, although there are other risk factors that make some people even more prone to getting this cancer of the prostate, especially when you look at someone who has a family history. When your dad or your brother has had this cancer of the prostate, you may be at a higher risk. But that does not rule out the fact that everyone is a candidate to cancer of the prostate. And the exercise is really simple, the screening process. We basically do a blood test, and where need be, we do what we call a digital rectal exam, where we feel and we check out the size of the prostate. We also check out if there is any change in the prostate glands. Ideally, in cancer of the prostate, you will feel that the prostate gland is bigger than the normal size, and even the texture feels different. So those are the little things that we identify, and which can probe us to do more other investigations to really come up to see if the prostate has the cancer cells in it.
Cervical cancer is one of the most common cancers affecting women in Uganda and globally, worldwide. And the good news is that this cancer can be prevented. How can we prevent it? When we screen early, because during the earlier times of the cancer, it doesn't show any signs and symptoms. By the time you begin showing signs and symptoms, you probably may be late and it's cancer now. So the easiest way and the fastest way is for us to come for cervical cancer screening. Come and get screened. It can be detected early when there are just changes on your cervix, because it takes a long process, 10 years developing into cancer. So when you come early to get screened, some of those changes can be got and then they are treated before they turn into cancer. There is no way we are going to know if we do not come for screening. So with cervical cancer screening, we have a frequency of 3 years. After every 3 years, you keep screening. Often, many times, women go and screen once and they forget to ever go back to screening. But it's important for us to know that after every 3 years, you go back and take your screening test until you reach 60 years. If you have reached 60 and you have been screening frequently for the last 3 years, for the last 3 times backwards, those ones we say about 9 years, then you can stop screening. But even when you are 60, maybe you started screening at 55, you have to continue screening after every 3 years till at least up to 70. Then there are other groups of people. We said the people who are at risk. Risk meaning they can easily get the disease. So those ones, their time for screening changes. We can do like after every year, depending on the test we are using. For example, women living with HIV, those ones we screen them more frequently because of the association HIV has with cervical cancer. Then there are other groups of people maybe who had a positive test earlier. We can, when they have signs to show that they are at more risk of getting this disease, we increase the time we screen them. We can be doing it like after every 6 months. So it depends mostly on how someone is exposed, if they have any risk factor. But if there is none of that, it's usually after every 3 years. So it is not the same for everyone until you come to the hospital. They screen you, then for you, the doctor will be able to tell you, for you, it will be 3 years. For you, it's 1 year. For you, it's 6 months.
For the cancer of the breast, we normally recommend screening for every after 3 years. For someone who comes, we have checked the breast, we find it is normal. We encourage them to come back after 3 years. Then for cancer of the prostate as well, we encourage you to keep checking every after 2 years. One thing I want to make clear is that when they screen you and the result is positive, it doesn't particularly mean that you have the cancer now. Because in screening, we do baseline investigation and examinations. After screening and it is positive, there are other investigations that we do to really ensure that we give you the right diagnosis. Most times at screening, someone may turn to be positive, but when we proceed with other investigations, we actually find this person has no cancer in the body. Because screening is very sensitive, it detects any change. So someone with a positive screening result may be further exposed to other investigations, because the gold standard test to confirm that someone has cancer is what we call biopsy, where we pick some sample from where we suspect the cancer to be, and this sample is critically examined to identify if they are cancer cells or not.
Let us encourage our young girls to be vaccinated. Girls from 9 years, they are being vaccinated in schools. There is HPV vaccine. Check if your daughter is vaccinated. If she's not and she's within that age, please take her for vaccinations. Those vaccinations are available freely in government hospitals. Then to ask the mothers, come for screening. Screening is free. Here at the Regional Cancer Center in Gulu, we screen you for free. You are not charged anything for screening, or you can move to your nearest health center. If Gulu is far for you, please go and get screened for cervical cancer. We can prevent it if we screen early. Then for breast cancer, you can screen, come to the nearest hospital, you can come to the Regional Cancer Center here or to any other hospital. They will do a clinical breast examination. The nurse or the doctor will palpate, touch around your breast to feel for anything within the breast, which we call a lump or a month. So we can even do some of this test. For example, for the breast, you can do it for yourself at home. You lie down or you stand up and put your hand up, pass your hand through your breast, palpate, do the same this side. If you feel anything within the breast that is hard, it is round, you can always come to the hospital and the hospital does more to that. So I'm calling upon all the women, let us come for screening, let us screen our breasts, let us come for cervical cancer screening, let's make sure our daughters are immunized for HPV, let us practice safer sex practices.
We offer the screening services for free for all those who are eligible, but also besides the screening, we are able to treat all the cancers at any stage that we find. So don't feel like a diagnosis of cancer is now a death sentence. It is not, and we strongly say it is not a death sentence because we are able to treat these cancers at any stage. We just encourage you to come and get help at the cancer center. Gulu.